Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Let's try to understand natural conception or natural pregnancy, which will help you in planning your pregnancy better. Natural conception or pregnancy is a very complicated affair, and it is the result of a perfect orchestra of ovulation, egg pickup by the fallopian tubes, sperms reaching the egg at the right time, and the fertilized egg or embryo reaching the uterus and embedding into the wall of the uterus at the right time. So, to understand the entire process, we need to understand the reproductive organs under the following headings: structure, function, ovulation. The female reproductive system consists of the uterus, 2 fallopian tubes, and 2 ovaries. The lowest part of the uterus is called the cervix, which opens into the vagina where sexual intercourse occurs. The end of the tubes have finger-like projections called fimbriae, which do the essential function of picking up the eggs from the ovaries. The ovaries have follicles within which are the eggs. Each follicle is filled with fluid and has 1 egg usually. The male reproductive system has 2 testes stored in the scrotal sacs and ducts which open into the outside via the male organ, that is the penis, along with the urethra. So what are the functions? In a man, every 72 days, fresh sperm are produced at the age from the time of puberty, and the process continues throughout their life. So at any point, the sperms are not more than 72 days old. However, the testes are placed outside the body and are maintained 2 degrees lesser than the body temperature. In women, it is a little different. A woman is born with a fixed number of eggs, after which there is no fresh production of eggs. To add to this, every month there is a natural destruction of a cohort of eggs. So, a girl born with millions of eggs will have only a few lakhs of eggs at puberty and will be left with a few thousands after the age of 35. As women advance, the eggs are also old, her age is equal to the age of her eggs, and the best eggs are recruited in the early part of the reproductive cycle. So, the remaining eggs will be inferior in quality. Let's look at ovulation. Every month, 15 to 20 follicles are recruited per ovary, of which we can see only 5 or 6 per ovary. Follicles are not eggs. Don't think that when you do a scan, the dark circles that you see are eggs. These are just follicles. Inside the follicles are contained the egg. Out of this, only 1 follicle, which is the most sensitive to the hormones, will grow. Once it reaches 18 to 20 mm, it can rupture or release the egg, which is picked up by the fallopian tube. If everything is alright, if the anatomy is fine, it remains alive in the tube for about 12 to 24 hours. Some studies have also said 48 hours, before which the sperm has to unite with it, to speak in easier terms, to form an embryo, or else it will just degenerate. So once natural intercourse occurs, sperms are deposited in the vagina and most of them get trapped in the cervix, which acts as a natural filter against microorganisms, and so they end up being held back in the cervix itself. Only those which have got motility will be able to swim across the cervix and reach the uterus, and then finally make their way to the fallopian tubes. The fastest sperm which reaches the tube is the one which might fertilize the egg. Once only the sperm which is healthy enough to fertilize the egg will be able to do so. Once the embryo is formed, the cilia inside the tube pushes the embryo to the uterus, and this usually occurs around 3 days later, where it is embedded into the inner layer of the uterus on the 5th or the 6th day of embryo formation. This process is called embryo implantation, and it starts after 7 days of ovulation. So you understand, once you've ovulated, the egg is fertilized. Around 7 days later only this implantation occurs. When the embryo is implanting, beta-HCG hormone is secreted, which is detected in the urine or through the blood. Blood is more accurate. This is the hormone detected by pregnancy test. As the pregnancy proceeds, these hormone levels also increase. When the levels are above 1000, a gestational sac or pregnancy sac can be seen in the uterus through transvaginal ultrasound. Hope you kind of understand how a spontaneous pregnancy happens, and this way you will be able to plan better once you know your ovulatory cycle. If you want to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.